Hello, my name is Caitlin Fleming and I have chosen to undertake a research task regarding the question, is ibuprofen more effective than paracetamol in the treatment of pediatric fevers? This is an important question to investigate as these are common medications administered to pediatric patients every day, and it is integral to understand and ask questions as to why. Is one drug more preferred than another? Without conducting further research, it is unclear as to why doctors prescribe these drugs. So I began to conduct my search in order to provide a clear answer to this question. Is ibuprofen really more effective than paracetamol in the treatment of pediatric fevers? Let's find out together. Began my research task, I started by instigating a search with 2 investigative questions to determine which one I could find the highest levels of evidence for. Through the combination of the PICO framework and the use of alternate words, I started by searching the question, is ibuprofen more effective than paracetamol in the treatment of pediatric fevers? In comparison to the question, is drug testing at music festivals an effective method of reducing death amongst adolescents? After finally refining my search to 11 articles, I was able to identify which question provided me with the most current, relevant and reliable information regarding each topic, which led me to choose the question, is ibuprofen more effective than paracetamol in the treatment of pediatric fevers? Once this selection had been made, I had to navigate my way through the search engines by reading multiple abstracts to determine which article produced the highest level of evidence regarding the chosen question. The process of PICO is a framework used in evidence-based practice to frame and answer a clinical or healthcare-related question. In relation to the question I have chosen to investigate, P for population refers to pediatrics, I for intervention refers to ibuprofen, C for comparison refers to paracetamol, and O for outcome refers to the treatment of fever/no fever. When undertaking this research task, I had chosen to incorporate both the use of Snug and Medline as my databases of choice to ensure that I was finding the highest level of medical-related evidence that is available. Medline and Snug are both used by healthcare clinicians as they are great qualitative databases and are quick and easy to navigate a search. Medline is the National Library of Medicine's database that contains more than 29 million references to journal articles that relate to the health sciences. It contains carefully selected links to online resources with authoritative health information on broad ranges of different topics. Because of this reason, Medline was the main database that I explored and the one that produced the best answer to my question of, is ibuprofen more effective than paracetamol at treating pediatric fevers? When conducting this research task, I incorporated both the use of keywords and alternate words to ensure that the articles I found were the ones that best answered my investigative question. A keyword can be described as an important word or concept that can be derived from or found in your research question. In regards to my search, the keywords used were pediatrics, ibuprofen, paracetamol, and the treatment of fever. Alternate words can be synonyms for the keywords. The alternative words used to complete my search were children, kids, Nurofen, Panadol, acetaminophen, and afebrile. After determining the keywords and alternate words I was going to use to conduct my search, I implemented the use of limiters. The use of limiters allows the database to refine your search by providing you with a lower number of articles to review, but also at a higher academic integrity, as this ensures the database only generates articles specific to your question. In terms of research, limiters allow the researcher to narrow down the focus of the search. When searching the databases, I selected the limiters of full text, journal articles, a date range from 2011 to 2021, and for all articles to be displayed in English. By using these limiters, I was able to refine my search from 227 articles down to 20 articles. Following this step, I needed to further narrow down my search by finding the best article to answer my question of, is ibuprofen more effective than paracetamol in the treatment of pediatric fevers? After refining my search through the implementation of keywords, alternate words, and the use of limiters, I was able to find an article I believe best answers the question of, is ibuprofen more effective than paracetamol in the treatment of pediatric fevers? This article was written by B. Long in May of 2021 and is titled Ibuprofen versus Acetaminophen for Fever or Pain in Children Younger than 2 years. This article is a meta-analysis, making it the highest level of evidence on the pyramid. A meta-analysis is a quantitative and statistical analysis that combines the results of multiple scientific studies, and they have become a common way for synthesizing evidence and summarizing the results of individual studies. Throughout the article, a higher number of benefits were discussed about ibuprofen in fever management rather than acetaminophen. Those benefits include the fact that they were able to see a 12.5% reduction in fevers within 4 hours with the use of ibuprofen versus acetaminophen, and an 18.5% reduction in fevers within 4 to 24 hours with ibuprofen rather than acetaminophen. In conclusion of the article, the meta-analysis indicated that ibuprofen is more effective in reducing temperature at various follow-up periods compared with acetaminophen. However, the American Academy of Pediatrics recommends against the use of acetaminophen in infants younger than 3 months or ibuprofen in those younger than 6 months without clinical evaluation, although it states that both medications are safe and effective when used appropriately. Because of these findings, I believe that the meta-analysis found on the Medline database titled Ibuprofen versus Acetaminophen for Fever or Pain in Children Younger than 2 years best answers my chosen clinical question of, is ibuprofen more effective than paracetamol in the treatment of pediatric fevers? Through the use of the Gibbs reflection model, I was able to identify areas that I needed to reflect upon as they made completing this task much more difficult than they needed to be. For example, I left starting this research task until the last minute, which caused stress levels to be higher and made tasks harder to complete with the added pressure of the minimal time left to complete the task. If I had started this task when I originally planned, I would have been able to delegate portions of my time to complete smaller sections of the task on different days to ensure the quality of my work was higher and the level of stress was minimized. By starting this task at an earlier date, an abundance of stress would have been eliminated and I would have been able to complete this task in stages. Therefore, if I were to complete this task again, I would most definitely make sure to start the task earlier.